Hello everyone, myself Spoorthi, Program Coordinator and Assistant Professor from the Department of Cardiovascular Technology, Yenepoya School of Allied Health Sciences. So today I will be presenting a topic on common atrium, which is a rare congenital heart disease. So at the end of the session, students will be able to define the common atrium based on the criteria and to explain the various modalities in the diagnosis of common atrium and also to explain the treatment strategies involved in the common atrium. So to define common atrium, it is an unusual form of congenital heart disease which is also called as quadricular biventricular. It may be confused with the clinically more commonly encountered partial or complete AV canal defect. So this anomaly, this congenital heart disease, it is similar to partial or complete AV canal defect. So since I told it is very similar to other congenital heart disease, we have certain criteria to define common atrium. So the first criteria is there should be complete absence of atrial septum, or at most its representation by a small strand of tissue which is present in the cephaloid wall of the common atrial chamber. So the first condition is there should be complete absence of the interatrial septum. So interatrial septum is a connection between atrium, right atrium and the left atrium. So this is the defect related to interatrial septum. So in this defect, there should be complete absence of interatrial septum, or there should be a very small strand of tissue at the upper roof of the common atrial chamber. So this is the first condition to define common atrium, and the second condition is there should be absence of interventricular communication. That is, there should not be any ventricular septal defect. The ventricular septum should be intact in this condition. And the third criteria is there should be accompanying cleft in the anterior leaflet of the mitral valve. So that is, there should be a cleft present in the anterior mitral leaflet. So these are the three conditions to define common atrium which has to be present in the common atrium, mainly to differentiate common atrium from other similar congenital heart diseases. So this is a picture showing common atrium. So if you see here, there is almost absence of common interatrial septum, and you can see some strand, some small tissue in the upper roof of the common atrium, which is the most important criteria to be present in the common atrium. Coming to the epidemiology, so this common atrium, it usually occurs in isolation, or sometimes it can also be a part of complex heterotaxis syndromes like right isomerism or left isomerism, or it can also occur as a part of Ellis-Van Creveld syndrome. So altogether it occurs less in 1%. So it is very, as I told, it is a very rare congenital heart disease which occurs in less than 1% of the other congenital heart diseases. So coming to the embryology, so common atrium results mainly due to the developmental arrest. So during the formation of interatrial septum, we have three steps. That is, the first is the formation of the septum primum, then septum secundum, and as a last step there will be fusion of septum primum and septum secundum. So this is a normal formation of interatrial septum. So if there is any developmental arrest during the formation of interatrial septum, it can result in the common atrium. Or if there is any impairment in the formation or any abnormalities during the fusion of the atrial septum, so all these conditions, impairment in any level in the formation of the interatrial septum might result in common atrium. And it can also range from more severe common atrium, that is the primary atrial septal defect, or to less severe patent foramen ovale, that is nothing but the secondary atrial septal defects. So as I explained before, common atrium usually associated with the common heterotaxis syndromes. So which is also the types of heterotaxis syndromes are right isomerism and left isomerism. So firstly we will talk about the association with right isomerism. So in the right isomerism is nothing but on the left side, the structures which is present in the right side will also be present on the left side. So here there is an almost 50% incidence of common atrium to be associated with the right isomerism. So almost 50% of the cases of common atrium will be associated with the right isomerisms, and in this condition we can see asplenia. So this right isomerism is also called as asplenia. syndrome. So where there will not be presence of spleen, and also the liver will be midline, that is situated in the midline of the thorax, and there will be the the hepatic vein, the right and left hepatic vein will be entering the ipsilateral sides of the common atrium, separate from the inferior vena cava attachment. So that is about the right isomerism. When we come to left isomerism, the common atrium occurs in almost 1/3 of the left isomerism. So this complex, if it is associated with the left isomerism, then we can see polysplenia, that is the presence of more than one spleen, and also it is associated with the interrupted IVC and the anomalous pulmonary venous connections to both the sides of the common atrium. So pulmonary venous attachments we can see on both right and left side of the common atrium. So this is about the association of common atrium with the right or left isomerism. So next is a syndrome. So as I already told, it can also be present along with the syndrome called as Ellis-Van Creveld syndrome. So it is a rare genetic abnormality which is characterized by tetrad of chondrodysplasia, ectodermal dysplasia, pondydactyly and congenital heart disease. So Ellis-Van Creveld syndrome, it is a condition where there will be 4 abnormalities. So chondrodysplasia is nothing but the abnormalities of the cartilage and the bones. There will be faulty development of cartilage and the bones. And ectodermal dysplasia is the ectodermal structures will be abnormal, and polydactyly is nothing but the presence of more than 5 fingers or the toes, and any of the congenital heart diseases. But this congenital heart diseases occurs in approximately half of the patients with Ellis-Van Creveld syndrome, and out of those 60% of the congenital heart diseases will be common atrium. And one more syndrome called as Ivermach syndrome. This syndrome consists of intracardiac anomalies, abnormal lobation of the lungs and abdominal heterotaxy. So this is a picture depicting the features of Ellis-Van Creveld syndrome. In the first picture we can see there are 6 fingers, so that is nothing but the postaxial hexadactyly, and in the second picture we can see pec teeth and malocclusion. Pec teeth is nothing but the small conical teeth, and also the malocclusion is nothing but the alignment of the teeth will be abnormal. So these are the features showing Ellis-Van Creveld syndrome. Coming to the clinical manifestations, so in common atrium with the complex lesions, the symptoms and the findings of coexisting complex lesions will supersede that of the atrial component. So if the common atrium, if it is associated with any complex lesions, so the symptoms of complex lesions will be presented. And when the entire septum is virtually absent, so there is a mandatory admixture of the blood which is received from systemic and the pulmonary circulations into atrial cavity. So admixture of the blood is nothing but the mixing of saturated and desaturated blood. So here in the common atrium condition, we have a common chamber where there will be mixture of saturated and desaturated blood. That is, the blood from the systemic veins and the pulmonary veins will get mixed in the common atrium. So because of which the patient can present with mild desaturation. Coming to the symptoms, symptoms of high pulmonary blood flow predominate in infancy. That is nothing similar to the symptoms shown by the large non-restrictive atrial septal defect. And because of this, because of high pulmonary blood flow, patient can present with the dyspnea on exertion, that is the shortness of breath, rapid breathing, failure to thrive, that is the developmental abnormality of the baby, suck rest suck cycles. This is nothing but the feeding pattern. So feeding pattern where the baby takes frequent pauses between the feeding. During feeding, the baby takes frequent pauses. And excessive sweating and symptoms, all these symptoms will occur and it will progress faster than isolated atrial septal defects or primum defects. So the symptoms of common atrium will occur earlier, and also it progresses faster compared to ASD. Coming to the diagnostic criteria, that is first one is the ECG. So ECG wise, the rhythm will be usually sinus, but in the setting of abnormal situs, if the patient is presenting with any kind of heterotaxy, then some degree of conduction blocks we can see. Usually complete heart block criteria we can observe in ECG. Other than that, P waves will be in the lead 2, 3 and AVF will be tall and broad. And there will be prolongation of the PR interval. PR interval will be more than 0.20 seconds, and the mean QRS axis might show left axis of deviation or the superior axis of deviation, and the QRS will be notched in the inferior leads, that is in the 2-3 AVF, the QRS will be notched, and also RS-R' pattern we can observe in lead V1. So this is the ECG of a patient presenting with common atrium. So here we can see left axis of deviation because lead 1 is positive and lead AVF is negative. So left axis of deviation is observed here. And also if we see lead V1, there is RS-R' pattern, that is a small r, small s and a tall r dash. The QRS wave in the inferior leads, we can see the notch. Coming to the chest X-ray part, so we can see cardiomegaly in the chest X-ray. So cardiomegaly is nothing but the cardiothoracic ratio will be more than 0.6 in infants and 0.5 in adults. So, and also there will be right atrial enlargement and right ventricular enlargement. So this is the chest X-ray of a patient presenting with common atrium. So here if we see, there is cardiomegaly, that is nothing but the cardiothoracic cardiomegaly we will be discussing mainly based on the cardiothoracic ratio. And also if you see the right border of the heart, right border of the cardiac shadow, it is involving more than 3 intercostal space, so which suggests right atrial enlargement. And if you see the cardiophrenic angle, that is the angle between the cardiac shadow and the diaphragm, it is acute, which suggests of right ventricular enlargement. So this X-ray is showing cardiomegaly, right atrial enlargement and the right ventricular enlargement. Coming to the echocardiography, so subcostal imaging is the best imaging view for the diagnosis of common atrium. So here we can see the absence of interatrial septum and also the normal and abnormal patterns of pulmonary and systemic vein connections we can see in this view. And in the apical 4-chamber view, it is very useful in assessing the ventricular cavities and the atrioventricular valves, because I have told as a part of criteria to diagnose common atrium, the cleft anterior mitral leaflet should be present. So that condition can be diagnosed in this view. So when one of the ventricle look unusually small, so because of which measuring the annuli of the atrioventricular valves and comparing them against the Z-score chart. So whenever we feel the ventricles are small, we have to compare, we have to measure the dimension, and based on Z-score charts, we are assessing whether there is any enlargement or not. And the view also provides good assessment of atrioventricular valve morphology. So that is what, same thing, to see the anterior mitral leaflet cleft, we will use this view. And this is a picture showing common atrium. In the first picture you can see the interatrial septum is absent, and in the second picture you can see the tricuspid and the mitral valve level are in the same, both the valves are in the same level, which occurs in common atrium. And also in the subcostal view we can see the IVC, if there is any association of common atrium with the interrupted IVC, then you can see in the subcostal view. And also color Doppler assessment will help us to see whether there is any regurgitation, or if there is any regurgitation, to assess the direction of the jet, we can use this color Doppler imaging. Other modalities is the angiographic findings. So angiographic findings, it is a definitive diagnosis which can be established on the basis of angiographic findings. So the hemodynamic findings are complete mixing between the systemic venous and the oxygenated pulmonary venous blood at the atrial level. So any step up oxygen level can be assessed by using angiography. Coming to the cardiac CT and the magnetic resonance imaging useful. So CT evaluation with the contrast study is useful in delineating the systemic and pulmonary venous causes. That is again the attachments of systemic veins and the pulmonary veins we can assess using CT. And MRI of the heart can provide the data that 2D echocardiography cannot provide. So when the data acquired from the echocardiography is not sufficient, we can go for the MRI, where MRI gives us the information about the lack of atrial septum, amount of shunting, the size and function of both the ventricles, and along with these informations we can also get the information regarding pulmonary and systemic vein attachments, and also any accompanying associated lesions can be found out by using MRI. Coming to the treatment, that is the management part. So once the diagnosis is confirmed, the main objective is to get the anatomical repair early. So preferably by 6 to 12 months of life, the anatomical repair should be done. And if the patient is asymptomatic with the normal pulmonary artery pressures, then need not be given any of the medications, other than there should be a watchful observation of the child. And the use of diuretics and angiotensin converting enzyme inhibitors can be advised in symptomatic patients, especially when there is atrioventricular valve regurgitation and the patient is presenting with the symptoms. We can go for the diuretics and ACIN inhibitors. For those with the post-operative pulmonary artery hypertension, targeted therapy for pulmonary hypertension may be beneficial. And surgery involves reconstructing the entire atrial septum, and this reconstruction of the entire atrial septum is done by using pericardial tissue. And a well reconstructed interatrial septum does very well in the post-operative period. That is, a prognosis of a patient who has undergone surgical repair is very good compared to other patients. To summarize, common atrium is a rare congenital heart defect where there is a single atrial chamber due to the absence of atrial septum, and it occurs in less than 1% of all congenital heart diseases. And this common atrium mainly occurs due to the developmental arrest or impairment in the formation and or fusion of the atrial septum. And surgical correction by reconstructing the entire interatrial septum shows good prognosis. These are the references. Thank you.